He was an activist for a better world. He stood for disability rights, the Charter for the Third Millennium on Disability, which he co-authored. But even well before then, he showed the connection between struggle and addressing disability rights.
Like many people, I have both a personal experience of the NHS and an interest in it that goes beyond the personal and is core to our view of a civilized society.
He made it very clear that without the excellent medical attention he got based on the universal health care inherent in the NHS system in the UK, he wouldn't have lived up to being a septuagenarian. And he spoke out loudly and unambiguously against the cuts in the funding of the NHS. He showed the clear linkages between good pay remuneration for health workers and morale, between adequate funding of NHS and the provision of a better world.
Opinion polls consistently show that the majority of the public agrees with me and is in favor of a publicly provided NHS and opposes privatization and a two-tier system.
One thing regarding Stephen Hawking that we must always have in mind was that he challenged the system. He did not only stand for universal health care. This was someone that, as a youngster in the university, he was part of the anti-Vietnamese war struggle.
There are two ways to think about a national health care system. One is that the most humane and civilized system is one in which all people are provided for equally, based only on their needs, no matter who they are, rich or poor, young or old. I believe this, and have made public statements, that we must prevent the establishment of the two-tier system, with the best medicine for the wealthy, and an inferior service for the rest. The other way to think is that a health care system needs to be organized in the most efficient way, so that there is as little waste of labor and resources as possible. International comparisons indicate that the most efficient way to provide good health care is for services to be publicly funded and publicly run.
Without universal health care, the world loses so much geniuses. There are several other Stephen Hawkings waiting to be tapped, but that might never be tapped because they are in systems where they cannot access the requisite excellent medical attention. Rest in power, Stephen Hawking.